of the country's greatest visionaries and thought leaders gathered in Sydney yesterday for the annual TEDx Symposium, sharing ideas and innovations on the theme of humankind. Record crowds of around 5,000 turned up to hear talks on everything from Mars missions and artificial intelligence to women in sport. One of those speakers was Robobiologist Anjali Jaiprakash, who joins us now. Anjali, thank you so much for coming in on this Saturday night.
Thank you for having me here.
You've just done a TEDx talk. That is extraordinary. This is nothing compared to that. So you're a robobiologist. That's a term we don't hear very often. So it's combining the two fields of biology and robotics. How does that marriage work?
I work at the intersection of medicine, engineering, design and healthcare. So we build assistive tools for surgeons so that they can enhance their abilities and perform accurate surgeries.
So what are some of the applications for the lay people like us of robobiology? How are you using it in medicine?
We're at a very exciting time. Robots are learning how to sense in many ways, and we believe that vision in robotics is going to be a game changer. It's going to change the way we interact and play and live with robots. They're evolving similar to the way we did, and I think in healthcare it's going to have a huge impact. One of the examples is we've used robotic vision technology called light field to build a device that can image the retina. It is way beyond any current retinal devices that you can find. For the first time, we're creating 3D depth maps and metric measurements of the retinal features, meaning you can track and monitor changes that's very specific to you.
So the advancements, obviously, in robobiology and in this field of artificial intelligence and robotics are obviously huge, especially in medicine. Should the medical profession be worried? Are they going to be out of a gig?
Absolutely not. You know, robots are not going to take over the world.
We heard that here. That's
yeah. It's very important for us to understand that we need to focus not just on developed health systems. I'm talking just in healthcare. We need to look beyond that, think beyond how we could reach out to people where there's no access to anything. And I think by embracing the positive features of technology and robotics and AI, that's a way forward for us to reach out to people and meet society's needs.
Because that's one of your passions, isn't it? One of the things you talked about at TEDx is using medicine to make it more accessible and more affordable for everybody, for developing countries as well. How does Robobiologics help with that?
It's again, access. So robotics is actually the physical thing that understands decisions to act. So the intelligent bit is the AI. So when you combine both of these, you can have automated, personalized diagnosis anywhere. And often we think about robots need to be perfect. Humans are not perfect. And in healthcare, and especially in developing countries, sometimes it's better than having nothing.
I guess it's a lot cheaper, isn't it, to use robots rather than...
It will. Currently, they're not. I think in the future, when everybody embraces this technology, it will have a huge impact.
So rather than see it as a threat,
yes,
the medical profession needs to actually see that we can work in collaboration, and that is the more efficient way to go about it.
That is a very efficient way to go about. But again, it's really hard. I haven't really brought about any change, but I hope that in the future I will be able to work towards reducing preventable blindness with the device that we have built.
You can actually see that happening? That is a possibility?
Yeah, I see that in the near future. But again, innovation is very easy to talk about. We are faced by skeptics all the time, legacies in systems, legacies in processes, and my personal favorite lately is legacy in people. So when we, and that's the biggest challenge, and hopefully someday I'll be able to make an impact.
It sounds like you already are. I wanted to say you've received various accolades in your career. You're named as one of the 25 women in robotics you need to know about. That's an incredible title. And the Young Tall Poppy Science Award you received as well. Do you see yourself and do you want to be a role model for young women in science?
I know this is a very hard question for me to answer. Really, I struggle with these questions. I'm just doing the best I can, and it's not easy. I have really, really great mentors and good people that I work with, so it is easy for me to sit here and say beautiful things. There are lots of challenges, but I think I've been very lucky with some of the great mentors I've had. If I'm a role model, if someone looks up and says she's good, well, I hope to continue to do that.